We are very pleased to be joined today by two spokespeople from UNRWA in Gaza, Louise Wateridge, Senior Communications Officer, and Sam Rose, Senior Deputy Field Director, who will brief you virtually from Deir al-Bala in central Gaza. Ms. Wateridge and Mr. Rose, welcome. Mr. Wateridge, the floor is yours, please.
Thank you. Yes, so we are in the middle area of the Gaza Strip, and to describe the situation here, it's just catastrophic. The last couple of weeks, we have had relentless forced displacement orders in the middle area, in the southern area, and also in northern Gaza Strip. And what we're seeing here is hundreds of thousands of people forced to move on a daily basis. It's really changed over the last few weeks, the last couple of months. What we're seeing now is families, mothers, children dragging their belongings. Most people are moving by foot. There's very limited access to any kind of vehicles for this kind of displacement now. And people just don't know where to go. If you see the humanitarian area, if you see the Khan Yunis, Mawasi area, you can barely even see the sand of the floor anymore. It is just packed, shelter to shelter. People are using the sand and building walls with the sand to stop the seawater coming into their makeshift shelters. So that's the kind of dire conditions that we are experiencing here. There are scorpions, there are mosquitoes, rats, mice, snakes among the population who are living in these conditions. We're seeing an increase in spread of disease. As most are aware, we've now had the first confirmed case of polio in the Gaza Strip since the last 25 years. And this really just speaks to how dire the conditions here are in terms of, lack of access to clean drinking water, the trash that is piling up everywhere among the population, among the conditions where they are living, sewage water, which is absolutely filthy. Again, people living among this, and desperation. When you speak to people here, when we speak to our colleagues, there is very limited hope now. People are really, really, as always, hoping for a ceasefire. They express to us that is their only hope now. It feels that you are never very far away from the front line. Really, the space that people have been confined to is so minimal. There are tanks in areas that used to be designated as safe areas. And this is just another testament to there being nowhere safe in the Gaza Strip. People have nowhere to go. There is nowhere to find safety. It's very limited access to humanitarian resources. Because the humanitarian operations are also being displaced within these evacuation orders. And the humanitarian response here is being completely strangled and limited to our ability of what we can do. I will pass to my colleague Sam Rose to continue the briefing.
Thanks, Louise, and thanks for the opportunity to talk to you. And I mean, look, as Louise said, it's a particularly fragile moment. We've seen a slew of evacuation orders over the first weeks of August, a couple of 100,000 people on the move yet again. And just like them, we are being squeezed into ever smaller areas of Gaza. The humanitarian zone declared by Israel has shrunk. It's now about 11% of the entire Gaza Strip. And this isn't 11% of land that is fit for habitation, fit for services, fit for life, really. These are sand dunes, these are crowded areas where, as Louise said, people are living cheek by jowl, doing whatever they can to get by. The streets are packed as people receive evacuation orders. They're on the move. They don't know what to do. Do they stay? Do they wait? Or do they go now? They're faced with impossible choices, and essentially what's happening is more families are being split, as some stay put, and others try and find whatever it is that they can find to put up their meager belongings. And this is the environment we're in: lack of access to aid, lack of access to services, to to water, to healthcare. And it's precisely in these circumstances that polio has recently re-emerged in Gaza with a small number of cases that could spread very rapidly. It's really that perfect storm of conditions that have created the environment in which polio can occur. Malnourished children, a decimated health sector, very poor water and sanitation services and conditions, people living amid garbage, living amid lakes of sewage. They're stressed, they're anxious, immune systems are suppressed. So it's precisely the eventualities that we as an international community have been warning about for so long are now coming to pass. We're working collectively. All our efforts are now geared on making the polio campaign, which will start this Saturday, into a success. It involves mass human resources. Over 3,000 people in total will be working on the campaign, over 1,000 of them drawn from UNRWA, which is essentially the largest primary healthcare provider left in the Gaza Strip. The vaccines have come in. We're calling for calm. We're calling for humanitarian pauses that will allow the vaccination programs to pass and be implemented successfully. We continue to hope for the best, and we have to, because without that, everything is gone. But look, the past 10 months have just told us that the only thing we can say with any certainty is that tomorrow will be worse than today. That's the nature of the environment. It's the nature of the situation that unfortunately we are dealing with here. And the people of Gaza, the 2.1 million civilians, are continuing to live through on a daily basis. That's all I think I wanted to say. We'll hand back to you, and we're very happy to take questions for as long as you have.
Thank you very much. Michelle, please go ahead.
Hi, both. Michelle Nichols from Reuters. Thanks so much for doing this briefing for us. We really appreciate it. We've just heard from a senior UN official who said that given the evacuation order that was made yesterday in the area where the UN Central Command for all aid operations has been made, that as of today, basically all UN humanitarian operations have ground to a halt because conditions just don't allow for them to take place. What can you tell us about that, and how might this affect the upcoming polio vaccination?
Thank you. No, thanks for the question. Look, indeed, yeah, it was about this time yesterday evacuation orders were issued. There've been a slew of them over August, I think 13 or 15 in August to date. The ones last night affected a block of Gaza in which a number of UN international guest houses were situated. So a number of UN staff on the move, their buildings are evacuated. We're in the UNRWA guest house here, and we're accommodating a number of international staff. Others had to spend the night in one of our warehouses down in Khan Yunis. I mean, what I can say is that the humanitarian operations have been incredibly squeezed. We're getting very little aid supply in through Kerem Shalom. We estimate that 1 million people who we plan to assist with food aid in August will go without. But look, for UNRWA, we deliver our services directly through our workforce of 5,000 staff who are working on any given day. Our health services continue across 8 or 9 primary healthcare centres and over 90 health points that are operating in and around schools that have turned into shelters, where literally hundreds of thousands of people are seeking shelter. Those services are continuing, but indeed the space and the ability of the UN system, of the humanitarian system, to operate in Gaza is becoming increasingly difficult, is becoming increasingly constrained at a time when we need to throw all resources at this to deal with the issues that we're facing.
And just a really quick follow-up, you mentioned that there's 1,000 UNRWA staff involved in the polio campaign. Are they still working for UNRWA, or have they been seconded to a different agency? Because if I recall correctly, the Israeli ambassador said last week that UNRWA wasn't involved.
We're massively involved. I'm not sure there's a single UN entity anywhere in the world that would have been able to mobilize like we have mobilized to deliver or continue delivering health services across the Gaza Strip. We have over 1,000 people normally in our health clinics. We provide more primary healthcare consultations than any other entity across Gaza. We are not involved in bringing the vaccines in, but we are a key health provider and the only United Nations entity that will be delivering those vaccines through our health clinics. Other workers in other parts of the health system will be involved, but UNRWA is a critical and integral part of the public health system inside Gaza, and we are indeed a key player in that campaign. We estimate 640,000 children will be vaccinated, and up to 40% of those children receiving vaccines will receive those vaccines from UNRWA. But it's very much a whole of UN system effort involving different entities with different roles and different responsibilities.
Thank you very much. Sherwin, please.
Hi, Sam and Louise. This is Sherwin Briceby, South African Broadcasting. I guess we're just struggling to understand how you're going to reach the 640,000 you're talking about. As Michelle pointed out, we heard that UN operations largely have come to a halt in Gaza. You're talking about being squeezed. Do people have to line up for these vaccines? Where will they go for these vaccines? I don't understand how you're going to achieve the 640,000 given the conditions under which you're operating now.
Look, you're right. It will be incredibly difficult. We have delivered health services through thick and thin in Gaza over the past 75 years, partly through those health services that have been continued to deliver through conflict, through displacement, and it's partly through that we've been able to eradicate these communicable diseases over time, which have sadly re-emerged. We're calling for a pause, a humanitarian pause, to allow us to deliver those vaccinations safely so that the children and their parents can bring them to the clinics, so that our staff, our mobile staff, we have over 90 teams of mobile staff who will be working around the shelters, working around the clinics and the schools to deliver those vaccines. But it will be a very difficult operation, and it will depend, its success will depend very much on the conditions on the ground at the time. We and the rest of the system involved will do our absolute utmost to deliver the campaign, because without it, we know that the conditions will just be worse, sadly. But yeah, it's not guaranteed that it will be a success. We estimate around 95% of children need to receive the vaccines for the campaign to be a success. And look, I think the other thing I'd just add very quickly is that for those who do contract polio and who do get sick, the prospects for them as well are incredibly bad. If it's the sewage and it's the water conditions that have led to them contracting polio, they need treatment in healthcare facilities, in hospitals and clinics, many of which are only partially operating and have been for several months due to the conflict.
And if I may add to that, everything seen here has been unprecedented so far. Everything the United Nations has achieved in the Gaza Strip has been unprecedented. The conditions are unprecedented. Every day is a new challenge. Yes, this polio vaccination campaign is a challenge, a very, very big challenge for every partner involved, for the United Nations, for the families, for the children who are all living this fear and this displacement. It's a challenge for everyone, but I've seen, water wells here completely destroyed and then rebuilt by UNRWA staff in a matter of weeks. How did they rebuild it? There are no parts in it. They're sourcing parts from broken down cars and fixing, things that are, you would say, the unfixable, and now providing water to 100,000 people again because of it. Everything here is a challenge. Everything here is a struggle. This is the next in line, but the staff are dedicated and people will continue finding a way. It amazes me every day. They continue to come to work. Most of our colleagues are displaced. They are part of this population. They are struggling. What do they do with their families? The bombing and the strikes is relentless every night, every day. There is no safety. Everybody knows there's no safety. And yet they know it's for the best thing for the children, the best thing for their community. So they still come out and they want to be a part of this and to achieve this for themselves, for the community.
Thank you. Edie, please.
Thank you very much, Edith Lederer from the Associated Press, and thanks for doing this on behalf of the United Nations Correspondents Association. I just wanted to clarify a few things. Today is, you said UNRWA health facilities are operating. Are any Palestinians anywhere in Gaza getting food today? And are your other operations going on as well?
Yeah, I mean, look, I don't have the precise figures in front of me. As I say, we estimate we're falling short as a system overall on 1 million people in the month in terms of food aid. And this is a build-up of problems over several months. The problems at the crossing point, breakdown in law and order due to the absence of civilian staff, and the fact that people are constantly moving around and reaching those people with these life-saving services becoming increasingly difficult. We're bringing in very small numbers of trucks, we as a system, on any given day. We have, in recent days, been able to provide emergency food parcels to families facing displacement, facing bombardment, but at much lower levels than we have been able to in the past, and at much lower levels than are needed. We estimate that 500 trucks a day, as you probably recall, are needed. We're getting in as a system, around about 100 trucks a day, and this is precisely why we're seeing increases in in rates of malnutrition, in suppression of immune systems, and as well as the aid coming in. It's the services that people are able to access. With every evacuation, there are more services that become inaccessible, and what we've seen in Deir al-Balah, in the middle area, over the past couple of days, is loss of access to some of the main water points in those areas. So people surviving on absolutely minimal amounts of water. Our ability to repair those networks as well, massively constrained as well because of restrictions on entry of supplies, on entry of chlorine, to carry out purification, to carry out basic sanitary activities. You can't find soap on the market. Bars of soap are increasingly difficult to find. The probably most effective thing for basic hygiene, people no longer have, because of the difficulties and the grind and of life in Gaza, unfortunately.
Go ahead, please.
Just to add a recent UNICEF assessment, so this was in July, that 6% of children in the south and 1% of children in the north are getting the dietary requirements needed. So what that means is, meat, fish, fruit, vegetables, children are lacking this. And this is what their UNICEF assessment has found. So even when food is getting to people, there's been 10 months of a very severe lack of nutrition and clean water, as Sam said. Thank you.
I was asking because I'm trying to reconcile what the senior UN official said, that the UN is unable to operate today, and you're saying that, yes, your health facilities are still operating, and perhaps some food is getting to certainly very few people, but some people. And I wonder if you could address that, and then I have one last follow-up.
Yeah, absolutely. I mean, our services are continuing to the extent that they're able to continue, and UNRWA operates differently from other UN agencies in the sense that we deliver our services directly, predominantly through national Palestinian staff, which is quite different to the operating model for the rest of the UN system. Today has been more difficult. The past 24 hours have been incredibly difficult, particularly for some of our international colleagues. But for our national staff, many of whom I've been speaking to today, the clinics are open, where they are able to open. Our offices are open. Some services are continuing. I can only really speak on behalf of UNRWA, but I would estimate that 15,000 people today have received health services provided by UNRWA staff across the Gaza Strip.
Great. And in Deir al-Balah, we were told that the UN operations headquarters was ordered to evacuate. I know you were talking about these 5 guest houses, so do you know about the operations center? Are they looking for a new place? Have they found a new place? I assume you would be in contact with them.
Yeah, absolutely. I believe that was a reference to the OCHA offices, where the UN, OCHA is a coordination office, bring everyone together there. That was one of the guest houses / offices that was in the evacuation zone, one of the blocks where people were ordered to or given strong warnings to leave ahead of military operations. They have had to evacuate. When they will be able to go back, I don't know. We'd have to ask them. But the meetings that would previously take place there will now take place in a large UNRWA office in Khan Yunis. It was previously actually a large UNRWA office in Rafah, where we were providing these facilities and these services in Tel Sultan up until May, when again we were forced to evacuate. But yeah, those meetings, that convening hub will now be at one of the UNRWA offices, an UNRWA health center actually in Khan Yunis.
And what this does is it just adds to the confusion and the uncertainty. You know, we had a group of humanitarians who were displaced themselves last night, in addition to the population. But this isn't the first time. You know, as Sam said, there's been around 15 displacement orders in the last month, in just August alone. We've lost access to water wells, to reservoirs, to, you know, warehouses. This isn't the first time this month that humanitarians have had to, you know, reshape the humanitarian response. This has been happening for the last 10 months. Every time there is an evacuation order issued, our facilities are very often in those areas, and we have to stop what we're doing and rethink everything. Move somewhere else, move the health centers, rehabilitate health centers that have been destroyed and start using them again, add additional health clinics and health points into the shelters. You know, we're doing anything and everything possible to keep personnel moving, to keep services going, moving medicine, moving equipment, moving everything we can, finding new spaces to have as warehouses and distribution centers. But yeah, this is normal. This has been the unprecedented situation in this war. Every day, you don't know what's going to happen. We don't know what faces, and we have to take the challenges as they come.
Thank you very much.
Thank you. Abdel Hamid, please.
Thank you. Abdul Hamid Sayam from the Arabic daily Al-Quds Al-Arabi. And thank you for the briefing. I have few questions. Could you tell us what happened today, this morning in Al-Aqsa hospital? They were also ordered to evacuate. So what's going on, if you have first-hand information? And second, after Israel declared UNRWA as a terrorist organization, look who's talking, how is your relation with Israel? Do you tell them where you're moving? Do they cooperate with you? Is there any communication channels between you and Israel? And lastly, to Louise' question. You said this is unprecedented. So what do you call what's going on in Gaza other than a killing field or a slaughterhouse? Thank you.
So on the Al-Aqsa hospital, we don't have first-hand knowledge of this. It's actually very difficult even for us to to move because the military operations in the areas in Deir al-Balah, in Khan Yunis are so intense, and they have been for the last weeks, really. There's tanks on the ground, there's strikes, there's bombing from land, sea and air. So our movement is extremely limited because of this immediate danger and the threat. We've seen this before. We've seen health facilities that have been in close proximity to evacuation orders, if not in them. And a lot of the time, the health, they have to do what they can. So maybe they move patients before the entire population decides to flee that area. They try to transfer patients. They try to move medicine, similar to what I was just saying about just reinventing the humanitarian response as this war continues. In terms of our coordination with Israel, we are in coordination with Israel on a daily basis. The United Nations, we coordinate all of our movements. We coordinate, the humanitarian supplies coming into the Gaza Strip. And we continue to coordinate and share our coordinates with them. We have these facilities they're deconflicted facilities. We share the coordinates on a daily basis so that Israel and all parties know where we are operating from. This is supposed to, provide some kind of safety to our staff, to our personnel, to our operations. But as we've seen in this war, it's been incredibly difficult. If I was to describe the situation here, I mean, really, after 10 months, there's just no words. I don't have the words to describe what we see on a daily basis. There's no humanity left here. It's very degrading for the population, but really, when you talk to people, they tell you now that they are really waiting for death, that they have no hope. And it's very hard to hear this from people, that they have no hope to move anymore. They don't know where to go. And that the only peace they are finding is to spend time with their family, to stay sleeping at night with their family, so that if they're killed, if they die together. That is the reality here. And it's absolutely beyond devastating. Sam, I don't know if you wanted to add.
Yeah, no, look, Louise, I think you put it well. I mean, we know sadly that war is always dehumanizing, but the dehumanization that we're seeing here is on such a scale that it is, as we've said, it's hard to comprehend precisely what the population are going through on a daily basis. The degradation, the humiliation, the fear, the violence that impacts on every aspect of their lives and their being. I mean, this week, families should be preparing for their children to go back to school. It's the start of the school year. That's 625,000 people in Gaza. We can hear them outside the window right now because life in odd ways continues. I don't know if you can hear it, but there are children playing. There are children doing their best to kind of comprehend what's going on. And many of them are so young that they're ignorant to the realities of what's happening, but they'll see it in their parents' faces, in their grandparents' faces, in the death, in the misery that will impact them now and impact them and impact us long into the future as UNRWA continues to provide its services and help the population rebuild. There's going to be so many difficult things that we as a community will have to come to terms with, that is also quite hard to get your head around as we deal every day with tragedy, with displacement and with horrors, with massacres, as if they're normal because they've become such a normal part of people's lives. But it's precisely anything but normal what people are going through here.
Thank you, Daisy.
Yes, Xu Dezhi with China Central Television. First, two quick questions. Do you mind to share where you are in the more specific location? Is that under evacuation or you're in a safe place? And you mentioned that many people, they are very frustrated at the evacuation orders. What about the staffers, your UNRWA staffers? What are their sentiment? Are they share the frustration with other people?
Yeah, look, I can answer. We're in Zawaida, in a part of Gaza called Zawaida, which is in the middle of the Gaza Strip. We have Nusayrat above us, Deir al-Balah below us, and the sea to the west. So we're in the middle area of Gaza, one of the few areas of this part of the Gaza Strip that hasn't been subject to evacuation orders over the past several months. I think part of the 11% of Gaza that hasn't been subject to those evacuation orders. That's where we are. I mean, fighting is close by. I've lost count of how many rockets, bombs, shells that we've heard over the course of the day. I would suggest several dozen, and every one of those is, likely to be a life lost, or somebody facing lifelong injuries or losing property that they have spent decades building and investing in. And yeah, staff are deeply frustrated, deeply traumatized. I mean, this is a war like no other before, that's being played out on everyone's social media, on everyone's television and phone screen, and they can see that the world knows that this is happening, and yet the world is not able to do anything about it. They want to know why the norms, the international norms that govern the work that they do as employees of a United Nations organization, do not apply to them as human beings. These are the questions that they ask, questions for themselves, questions for their children, and it becomes increasingly difficult for us to answer those questions. What more to say?
Yeah, just a follow up. You just mentioned that the space and ability for UNRWA to operate has become more and more constrained. I'm just wondering, do you still have plan for future operations at this point? And we ask this question many times, that there might be a time, if this conflict continues, the evacuation orders continues, there might be a time that UN is not able to operate in Gaza. How far do you think we are here today from that point?
I mean, I'd say, first of all, I'd say we continue to operate as UNRWA day in, day out. The staff get up, most of them living in tents in the most abject conditions to serve their communities. That will continue for as long as is possible. People serving the communities, providing the most basic human services and humanity that they can to their fellow human beings. That will continue for as long as we are able to continue. I mean, UNRWA has gone through thick and thin over the past 75 years, but is such an important part of the service delivery infrastructure in Gaza that we will continue for as long as we are able to. The space shrinks, we adjust, we dust ourselves off, we reorient, but it's precisely the investments that the international community has made in UNRWA in terms of human capital, the staff, but also the services and the infrastructure and the systems that we have in place. It's precisely that allows us to continue providing these services in an environment of such abject conditions. When everything is needed, UNRWA is uniquely placed, along with others, but unique with the support of others, but we are uniquely placed to meet the needs of the population. So if there ever comes a day when we're not able to continue, it would be an absolute catastrophe for the people who have nowhere else to turn for healthcare, for education, for water, for sanitation, and for protection.
Thank you. Please.
Joseph Klein, Canada Free Press. Where is UNRWA in terms of the funding that would be sufficient to continue your operations in Gaza at the present time? And could you clarify in terms of you mentioned that UNRWA, to some extent, operates separately from other UN agencies, which I assume includes OSHA. So could you clarify that to what extent there are regular interactions with other UN agencies doing work in Gaza? Thank you.
Yeah, I mean, we coordinate on an absolutely daily basis with everyone in all the sectors in which we work as UNRWA. We're in constant coordination with other UN agencies, with international NGOs, with the Red Cross, with the Red Crescent. The difference when it comes to UNRWA is that almost uniquely amongst United Nations organizations, we deliver our services directly. So we have the teachers, we have the health workers, the doctors, the nurses, the social workers, the sanitation laborers. So when I say we operate in a different way, that was essentially what I meant. It's that direct delivery character of UNRWA as an organization that sets it apart from others. But look, everything that we do comes under the umbrella of the United Nations in terms of joint planning, in terms of joint assessments, common missions, common security assessments, things of that nature.
In terms of funding, sufficiency of funding?
Sorry, yes. In terms of funding, yeah, absolutely. I mean, we currently have funding for our overall operations as UNRWA until the end of September, so until the end of next month. These is funds primarily to pay for the salaries of our doctors, our teachers, etc. So we continue to face a fairly sizable gap for our regular programs, 30,000 staff, many of them in Gaza. And then on top of that, we put out a humanitarian appeal, part of the OCHA appeal for 2024 for $1.2 billion. That was our contribution to the appeal, or our share of the appeal, rather, in April of this year. That appeal, as things stand, is 25% funded. So we're facing a large gap of essentially $900 million on that appeal. But of course, as we all know, the situation in relation to Gaza is as much as partly about funding, but it's also about access, ability to get the aid in, the supplies in, ability to then distribute those supplies and get them to the people safely. And it's precisely because of the inability to do that we've seen, the most rapid deterioration in food security and malnutrition that we've seen anywhere in the world over the past several decades. So we face a funding shortfall for our appeals, but we also face issues in relation to safety and security, in relation to access. And that's why we're seeing such catastrophic humanitarian impacts, malnutrition, water shortages, disease outbreaks, etc.
Thank you very much. Do we have any further questions? If not, Louise Wateridge and Sam Rose, we thank you very much for your time and for this important briefing.